Welcome to our Positive Approach to Care information session, everybody. I'm Kate Lamont, and together with Kath Kirby, we're Thrive Aged Care. Over the next slide, please, Kath.
I've moved it, Kate.
Oh, have you? I can't. Oh, it's not going to mine. Oh, there we go. That was a bit awkward. A little bit about Thrive. We work with organisations that support older people to help you and your teams to be able to provide the best care that you can. And we do that through education, training and mentoring, providing specific dementia support, which we're going to tell you a little bit about today, and also service review and improvement support. So if you haven't heard of us, thanks for coming along and joining us on our free Lunch and Learn webinar. Now, specifically about us and a positive approach to care, which we're telling you about today, we are trained in the Teepa Snow positive approach to care methodology. We met Teepa earlier this year and we were trained in her approach. We are clinicians, so Kath and I, it sounds scary, but together we've had over 40 years of clinical experience, myself as an OT and Kath as an RN, and we've worked all across the sector supporting people living with dementia at various stages of their journey. So the difference with us is that our team is comprised of clinicians with current experience in supporting older people and supporting people living with dementia. Now, why are we talking about a positive approach to care today? So over the next slide, thanks, Kath. Because we in Australia know, and you guys obviously coming along today know, that the prevalence of dementia is increasing. Yeah, because we know that as we age, the risk of dementia increases. So, the numbers are staggering in the next 30 years, more than 800,000 people living with dementia. And for those working in aged care predominantly, we know currently at the moment that 2/3 of people in aged care have moderate to severe cognitive impairment. Yeah. So we need to do something differently. We know that we have a lot of dementia training out there, which is fantastic. But I would question if it is actually translating into better practice, because we are still supporting lots of organisations, health, aged care and community providers who are wanting more education on how you can support people with changed behaviour. And that is what a positive approach to care can do. So we're very excited to tell you about it today. In the home care sector, we know that people are staying home longer, which is great if that's what people want to do, wanting to stay home longer. And we know that on top of formal care, people staying at home living with dementia are cared for by family members. So up to 75% of people are cared for by family members on top of formal carers as well. And as I said, people living with dementia are entering aged care with more complexity. And it is putting a lot of workforce pressure on those people who are supporting people at home to remain as home as long as they can. And again, as I said, supporting people with what they see as changed behaviours. And I use that term loosely because Kath and I don't really love the term changed behaviours. In fact, we kind of liked the term responsive behaviours because as our thinking is it was a response to something in the environment. Yep. Over to the next slide. So today you are here to hear about a positive approach to care, developed by Teepa Snow, an OT with over 40 years of experience working with people with brain change. Positive approach to care is an evidence-based methodology, and we're really excited to tell you about it today and to give you a little taster about what the training looks like. So over to you, Kath.
Thank you. So like Kate was saying, what is the positive approach to care? And like Kate said, it was developed by Teepa Snow, who is an OT with decades of experience and a dementia expert. And I encourage you, if you haven't heard of Teepa Snow, to Google her and have a look at some of her work, because she is an absolutely amazing clinician and person, and so is all of her team. Now, positive approach to care is an evidence-based program. And I guess the key difference with the training is it's not just teaching the how, it's teaching the how as well as the why. So it's a really practical approach, and that's why it really resonates with the with clinicians and carers who we have worked with. You can just see the light bulb go off because it makes sense. And when you can link the why with the how, that's where we see change in practice. So the focus of the positive approach to care is all about adapting the carer approach to meet the changing needs of the person who is living with dementia. And the ultimate goal of the training is to improve the experience for both parties, because it can be a challenging space that we work in, and people can lack confidence and feel uncomfortable in situations when they're providing care for a person living with dementia. And it comes back to their understanding of the why and not having the skills to do the how, which is all about our approach and focusing on building relationship and connection with the person. So let's talk about why it's different, because like Kate said, there's lots of training out there and it's amazing. There's lots of great content delivered by lots of different organizations, but this is a different way of delivering training. Yeah, there's lots of free training out there, but there is a lot of training that is very much self-directed, and it is very much, reliant on the person watching through all of videos, for example. So it's very passive learning. This is an active learning approach. It is focused on the adult experiential learning cycle. It involves a lot of role play scenarios, and that's even when we're doing our online training, we still are doing practical training through that as well. And it is amazing how much how interactive you can be in online training with this particular program. It is very much hands-on skill training as well. So it's practical. That is the main difference. It is practical. People walk away with skills after the first session that they attend. It isn't a death by PowerPoint. It is very suitable for people who may have English as a second language, which is, as we know in Australia, a high proportion of our carers who work with us. It teaches the person skills and techniques, and they have the opportunity to practice, and they receive coaching as well. So it is very different approach to watching a PowerPoint presentation. And like Kate said, it is delivered by clinicians. So everyone in our team is a clinician by background. We all have extensive experience working with people living with dementia, and we currently work supporting people still in clinical space. So we understand exactly the challenges that people face each day and what they see in their everyday work. So if we have a talk about what is it that we cover, what does the program cover? And it does talk about how the brain works, and it talks about how the brain changes for people living with dementia at different stages. The difference is, and this was said by one of our participants at our skills day a couple of weeks ago, was it's not theory-based. It's relating back the changes that are happening in the brain to what the person, the carer, is seeing in the person living with dementia. So it talks about vision changes, language changes, movement changes, and how that looks in common scenarios that carers face on a daily basis. And then we work with how to accommodate for those changes. So how do we adapt to meet the needs of the person living with dementia at whatever stage they may be? It talks about what is called the hand-under-hand technique, which helps to support not only connection between the carer and the client or the person living with dementia, but it also helps the carers to engage and enable the person to participate as much as they can to their best ability in the task that they are trying to achieve. So it really focuses on giving the person living with dementia control and dignity. And it's really working with a strengths-based approach rather than a deficit approach, which is what we tend to take when we're supporting people living with dementia. We focus on what they can't do as opposed to focusing on what they can do. And that's because we haven't been taught those skills. So in the training, we cover how to apply the PACT principles and the hand-under-hand technique differently in common situations, again, that are faced for people, for carers and for people living with dementia and the experience that they have. And we talk about and we teach how to use observation as an assessment tool to identify unmet needs at different states of dementia, and how we, again, adapt our approach because oftentimes we're expecting the person living with dementia to change. And, you know, if we don't change, then nothing is going to change. It's up to us as the clinician or the carer providing the care. So this is just some photos of us getting into action to show you it is, you know, it is practical training. There is a lot of getting up and moving. And again, this is whether it's a skills day or an online session, you will be up and moving and learning and practicing the practical skills, which we're going to do in a couple of minutes as well. So we can see here learning different techniques to assist a person at mealtime, assisting with redirection, looking at our approach and checking, you know, looking at visual changes and how that looks for the person living with dementia. So not only is the person learning skills themselves to support, but this training teaches the person attending what it is like for the person living with dementia. What are they feeling? What are they experiencing when a carer approaches them, for example, from the side or outside of that person's visual field? So I'm sure you're all aware, because you're all here and you're obviously very passionate about dementia care. But, you know, when we look at the main causes of responsive behaviours, changed behaviours, if we want to use the current terminology, but responsive behaviours, you know, they come back to all of these key points. You know, the changes in the brain, which we need our clinicians and our carers to understand. The changes or the inability to communicate, which again is something that we assume people know, but they don't always link it back to that brain change. And we still hear, unfortunately, terms like, you know, that person was non-compliant or that person refuses to participate. Yeah. So because there's a lack of that linking the why and the how. Changes in their environment, changes in vision, hearing or thinking, the health changes, the discomfort and emotional or physical changes that aren't being met. And the issue is when we have these changed or responsive behaviours, what do we do as clinicians? We label the person. So if somebody was rude to me or somebody came to me unexpectedly and I responded to them verbally, you know, with a verbal statement, that would be seen as acceptable. But when it is a person living with dementia, we label them as being physically aggressive or verbally aggressive, when actually we need to flip that narrative around and have a look at, well, what did we do to contribute to that situation happening? And that's really what comes out of this training as well. Now, having to think about, and this graphic I think is really key, and, you know, feel free to have a look at these slides afterwards. But if we don't get it right, if we don't change the way that we teach people, if we don't teach people how to change their approach or the why and the how, then we are on a very fine line when we are providing care to a person. You know, we want to be providing care with a person. And it is going to be very easy to flip from that nice central green section of this graph to either neglect, where we ask a person, would you like to have a shower today? And they say no. And then we document and say, Kate refused care. Kate declined a shower. Kate declined a shower for 7 days straight. Or flipping to the other side and saying, Kate hasn't had a shower for 7 days, so we need to get her in there. And then I try to get Kate into the shower, and my approach isn't fantastic because my understanding isn't great about how to approach or work with a person living with dementia. So therefore, what do? I get Kate, and then I go to provide care for Kate, and then I go and get Pam to come and give me a hand because Kate's resistive. And then the two of us is still not enough, so we go and get somebody else. And then we flip into almost the abuse category. So that is where we become more task focused. And, you know, we're missing that gap, that fine line in the middle. And that fine line in the middle, we can reach if we teach people the skills and we give them the confidence and the understanding of how to use this approach effectively. So when we're talking about positive approach to care, you know, what is the person going to get out of it? This is what we've seen. This is feedback from all of the sessions that we have run. And there have been participants from various levels. So from personal carers, from carers in the home, to registered nurses with many years experience. They all report feeling more confident, having increased skills to provide the care, having increased knowledge about the physical changes to the brain. So what that actually means for the person and how what we see. Improved confidence and, improved ability to build connection and relationships with the person, which is key because we throw the term around person-centered care a lot, but what does it actually mean in practice? So when we look at the team as well, it improves working relationships because there's less stress and improved well-being within our team because they have that confidence and competence as well. They have better relationships and engagement with the clients and the clients' loved ones or representatives. You see improved workforce stability because if a staff member feels trained and confident and competent, then they're not going to leave their role. They're going to come to work each day. You're not going to have high rates of sick leave. And your care is going to be delivered in an efficient amount of time. You're not using 3 staff members to provide care for somebody who really only needs one if we have the right approach. And what does that look like for you and your organisation? Less SIRS, less OVA, less refusal of care, better satisfaction, staff retention, improved recognition. Because if you're offering dementia-specific support, or you're offering, you're saying that you offer dementia-specific care, you want to have that positive reputation to say this is how we do it. We all need to meet compliance standards, but we all want to be well above that. And the new aged care strengthened standards has a very big focus on dementia care entwined into every new standard, so 1 through to 7.
All right.
So go for it.
So I think you guys want a taster. We're seeing that in the chat. So let's go to it. Let's go. Well, we've got 2 videos coming up, and I want you to look at the approach of the carer in both videos. Teepa Snow herself is in these videos, but I want you to think about why the approach is different, and is this stuff that you might see in your daily work life? Okay, so over to this video.
Oh, I don't know why there's no sound.
Okay, so that was video 1, Melanie and Teepa. Now let's watch Matthew and Teepa, and then we'll answer some questions. All right, thanks, Kathy. So looking at those 2 videos, I want you to get busy in the chat, okay? What did you notice about the approach? Okay, so what did you notice about Melanie's approach in video 1? And what did you notice about Matthew's approach in video 2? And why do you think the approaches were so different? So pop some comments in the chat about that. Now, they were wearing gloves because these videos were filmed during COVID, okay? But I'd love to hear a bit about what you noticed were the differences between Melanie and Matthew in their approach. So pop your comments in the chat. Now, while you do that, I'll tell you a little bit about the PAC principles. Oh, you didn't see the second video. Okay, sorry about that. In PAC, the first principle is the relationship comes first. We all have an agenda, don't we? And in those videos, the agenda was getting Teepa back into her room. But with PAC, the relationship comes first, and our agenda, what we want to get done, has to go in our back pocket. Okay, we'll get to our agenda, but the relationship has to come first. We are the key to making life better for the person living with dementia and for us. We know that people living with dementia are doing the best they can, and so are we. And unless we choose to change, nothing is going to change. Now, I see some great comments in the chat. Melanie used distraction. Matthew's approach seemed aggressive. Matthew's interaction escalated quickly. It did, Kath. It was a minute, basically, and Teepa escalated. Melanie did more listening to the patient and gentle distraction. Yes, there was a lot of validation, a lot of repeating back in Melanie's approach, wasn't there? Matthew seemed to be more confrontational to Teepa, where Melanie let her get through to what she wanted. Yep. So Melanie validated what she wanted and obviously knew a lot about her with the photos and a coffee. And there was a lot of rephrasing, repeating, repeating of words so that the person knew that they were being heard. Yep. Melanie allowed Teepa to express herself. Acknowledged how she was feeling. Great comments, guys. Lots of great comments. So Melanie used the positive approach to care, and there's some of the skills that to get to that level, we teach the skills to get there. So we're going to give you a taster now on some of those skills related to vision. So the next slide we see is of 2 brains. Yep, go for it, Kath.
Sorry.
That's all right. Now, these 2 brains are from men who were roughly the same age, height, weight, and head circumference at time of death. The brain on your left is a brain of a man who died in an accident, and the brain on your right is of a man who died after living with Alzheimer's for 10 years. Pop in the chat the differences that you notice with these 2 brains. Yeah, we know that our brain is a complex organ. Yes. The right side controls the movement on our left and vice versa. What colour and size? Great. So we're noticing difference in colour and size. It's shrunk. Great. I love it. Brain on the right seems dried. Yes, dried, shriveled, shrunk, shrinking. Excellent. Okay. So now looking at the next slide, what I'm going to show you is the occipital lobe. It's here at the back of your head. Okay, now the occipital lobe is your visual processing center. We take data in through our eyes and it travels to our occipital lobe to help us process what we're seeing. Thinking about the changes that the changes that are going on in the brain. Now these are the physical changes. We know on top of this, there's chemical changes for people living with dementia too. But thinking about this, what sort of functional difficulties do you think people living with dementia might have in relation to vision? Pop your comments in the chat. What do you think might be difficult in terms of spatial awareness? Excellent. Yeah. So knowing where you are in space and your environment and how that might impact on other tasks that you're doing. Yeah. Impaired vision. Interpreting data. Excellent. So that message is going to take longer to interpret, isn't it? To get the data from the eyes to the back of the brain. It's not, we don't have those connections. Yeah. So it might get jumbled up or it might take a little bit longer. I want to talk to you now about those visual changes. So with the positive approach to care, we talk about GEM states. We're not talking about that today, but just to let you know, GEM states describe different stages of dementia, okay? Now, I want you to sit and put your arms out and I want you to wiggle your fingers and I want you to look straight ahead. Now, if you're 25, which I'm not, you're going to be able to wiggle your fingers and you're going to be able to see your fingers moving even though you're looking straight ahead. Okay, that is your visual field. Each year as we age, our visual field reduces. That's why when we get to the age of about 75, our visual field is here, yeah? And that's healthy aging, yeah? But you'll notice as people drive, those head checks become more body checks, yeah? Because our visual field is getting smaller. Now, for a person with dementia, their visual field is impacted even further. Go ahead and pretend that you're wearing a scuba mask. This is for someone who is very early in their dementia journey. Okay, it's tunnel vision. Yeah, so that's scuba mask, tunnel vision. Now go ahead and make 2 circles and put on a pair of binoculars and have a look around your desk or where you're sitting. This is binocular vision, and this is for someone who is in more of a moderate stage of dementia, what we call an emerald state. Now go ahead and leave one binocular and cover one eye. This is monocular vision, yeah. And this is for someone who is in more of an advanced state of dementia, that ruby state, okay. Thinking about this now, what is the functional impact going to be for the people that you're supporting living with dementia? Go ahead and pop some of those functional things that are going to be tricky day to day in the chat, okay. And when you get up after this meeting, pop those binoculars on, go for a little walk and see the difficulties that you might have. Over the next slide, Kath. I want you to pop those binoculars on now, actually, and I want you to look down at your desk. And I want you to do what is naturally happens, yeah, when I say knock, knock. So I'm going to say knock, knock. That's it. Now look up and what do you see? Pop it in the chat. Hopefully you think I look friendly. Hopefully you can see my hand clearly next to my face. You can see my name tag up nice and high on my shoulder. These are all the skills that we teach with a positive approach to care. Getting in the right position so that you're in someone's visual field, knowing where to stand and how to adapt your approach based on the different stages of dementia so that we're not surprising people coming out of their visual field. Okay, so these are some of the practical skills that we teach. Over to the next slide, Kath. That was your taster, guys. I hope you go around and wear your binoculars.
So yeah, it's really important. It's a really actually good task to do, and please do it after today's session because it's really surprising. Even just put your binoculars on and try to reach for that drink that you have on your desk and see how hard it is for you, or have somebody approach you while you're wearing your binoculars walking around and see how you respond, because it's a bit of an eye-opener. So this is just some feedback about the training from our participants, and you'll get a copy of these slides as well. But we're really passionate, as you can tell, about this training because it is training with a difference. And you can see the light bulbs go off when you have people participating in this training. And our last skills day had all of our participants, apart from one, had done extensive dementia training, as had Kate and I, before we did this program. And it is very different. and you walk away with things that resonate with you and they stick with you, and it does change your practice. So we're really passionate about getting it out there and getting the message across and training lots of new people in these techniques. So we offer lots of different things. We offer individual training. So we have some public training. We work with organisations to offer training and mentoring. And we also offer, Kate is an OT and has a passion about dementia-friendly environments. So we also do, environmental reviews and support as well. The takeaway messages from PAC that we want you to go away and think about today is that the relationship always comes first. So how do your team members know to put their agenda, so what they need to get done in a day, in their back pocket and get the best participation out of the clients who are living with dementia that they are supporting? It's really important to understand, and we need to change this thinking that the people living with dementia are doing their best. So it is up to us to change, because if we don't change our approach, then we are not going to see changes in practice, and we're not going to see improved outcomes for people living with dementia. Another important thing to remember is stress affects all of us. It affects our brain as well. It impacts on our function, and the person living with dementia's function. So if we come to work and we're stressed, we have tunnel vision as well. That's where that saying comes from. So our approach, if we're stressed, working with the person living with dementia is not going to be helpful in that situation. That's why we need to give people the skills and the confidence to be able to provide that type of care. So in terms of training, if you have any questions, we will stop the recording in about 1 minute and we'll stay on. But we do have skills workshops and online training next year. We've finished up for this year, but we do have intakes happening in March, and we only do a couple of intakes each year. So our next one is in March, and we have very limited places because it is practical coaching type training. So if you're interested, we will send you a copy of the flyer. And if you're an organisation that, can see the benefit for your whole workforce, then we absolutely can work with you to provide that training on site, wherever you are in Australia, or online as well. So please do reach out, and we're very happy to have a chat with you about what it is you're after and what it is that we can offer. But we are 3 minutes over. I'm going to stop the recording so that if you do have questions, you can ask them. But otherwise, thank you so much for coming along, and we hope you got some good tips and tricks from today.
Thank you.
Thanks.